Superficial and extracapsular parotidectomy are surgical procedures which are used to remove benign tumor. Difference lies in surgical approach and anatomical dissection. Superficial parotidectomy. By definition, it is removal of entire superficial lobe of the parotid gland. In this, facial nerve dissection is done. The main trunk and branches of the facial nerve are identified and dissected to protect the nerve from the tumor removal. Indication mainly pleomorphic adenoma or Wortham tumor. Advantage, it is safe and having lower recurrence rate of the tumor. Risk are facial nerve weakness and Frey syndrome. Extracapsular parotidectomy. By definition, it is removal of a tumor from parotid gland with a margin of normal tissue but without identifying the facial nerve. In this, facial nerve dissection is not performed and tumor is removed just around the tumor with normal cuff of the tissue. Indication mainly small, well encapsulated benign tumor usually located in superficial lobe away from the facial nerve like tail of the parotid gland. Advantages, it is less invasive, shorter operative time and potentially fewer nerve complication. Risk are higher chance of inadvertent facial nerve injury and high recurrence rate is there. Now key differences like facial nerve identification is done in the superficial parotidectomy. It is not done in the extracapsular dissection. Extent of resection is entire superficial lobe, while in extracapsular it is tumor with margin only removed. Tumor size in superficial it is larger, in extracapsular it is small. Invasiveness, tumor is more invasive in superficial and less invasive in minimal invasive extracapsular dissection. Risk of recurrence is lower in the superficial, higher in the extracapsular dissection. Operative time longer in the superficial and shorter in the extracapsular. So these are the key differences. In summary, superficial is more thorough and safer or having low recurrence rate, while extracapsular is suitable for small benign tail of the parotid tumors which required minimum surgical time. So these are the key differences.